I'm Dr. Richard Bebb. I'm an endocrinologist. Diabetes is another very common reason that a patient may see an endocrinologist. Diabetes is very, very common here in the UAE. There are basically three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes or pregnancy-induced diabetes. Type 1 diabetes is less common and is caused by an inflammation in your pancreas, the organ that produces insulin. Insulin is necessary to keep your blood sugars down. An inflamed pancreas will not be able to make sufficient insulin. Your blood sugars go up, and most patients with type 1 diabetes require insulin very soon after diagnosis. In contrast to type 1 diabetes, type 2 diabetes is more common and is more an age-related onset. The older you get and the more weight you put on, the more likely you're going to develop type 2 diabetes. In addition, most patients with type 2 diabetes have a relative who developed it. It's a situation where you're still making insulin, but your body can't use the insulin properly, or as we say, you're resistant to your own body's insulin. With type 2 diabetes, it's very important to treat it with proper diet, ideally some weight loss, and in the early years, most people can be treated with pills as opposed to having to use insulin. Gestational diabetes is the third more common type of diabetes and affects a certain number of pregnancies in the situation where your body cannot compensate for the stress of a pregnancy. When a woman is pregnant, the placenta produces hormones that antagonize or counteract your natural body's insulin. And if your blood sugars end up going up in that situation, it can have adverse effects on the baby in terms of baby's development of certain organs, or the baby may just get very, very large if not properly treated, which can make problems when it comes time to try and deliver the baby. Most women with gestational diabetes can be managed with a good diet, lifestyle, although some will require insulin or possibly medications, oral medications, to keep their blood sugars in a safe range. The treatment of diabetes is a collaborative effort between you and your physicians and other healthcare personnel. It's not just about pills or insulin. Having access to a trained nurse, dietitian, endocrinologist, or other healthcare provider dealing with diabetes, and sometimes other specialties such as ophthalmology, neurology, nephrology, kidney doctors, or cardiology may be necessary. Proper diet, weight control, regular exercise, and regular visits to ensure your blood sugars remain in a safe range is critical to ensure the very best chance of a long life with minimal risk of any complications, and we'd be very pleased to work with you towards that goal.